Legendary broadcaster John Hewlett is one of the busiest men in the entertainment business. John co-hosts a top-rated morning show on K-Hits 96.3. Then at 10 a.m. he does another shift on KSHE 95, where John has been on the air for over 30 years. John's passion for broadcasting is rivaled only by his passion for running. He regularly competes in 5K, 10K, and half marathons. John has been suffering from plantar fasciitis and pain in his hip. That's why he went to see Dr. Michael Weiss and went through the WellWalk Tech Scan system. Let's hear firsthand about his results.
Well, we made a lot of progress since the last doctor visit. I mean, we were making progress all along, but we just, you know, it's a fine-tuning process, you know, and it can take a little bit of time to get it just right. And Dr. Weiss has done that with the use of Tech Scan. We use that as a tool, and then my sense of feeling about, you know, my foot and my walking and my balance, and I think we got it right.
Tech Scan is essentially a system using pressure mapping sensors. Pressure mapping sensors allow us now to see inside how the foot is functioning inside the shoe. As podiatrists, we would make orthotics typically, and we would know how a patient would function statically, which means how they function when they stand, where we can see their foot type. And then we would sort of have to hypothesize how they would function while they're actually walking. But how they're actually functioning during walking was a little bit of an educated guess. With Tech Scan technology, it's a company out of Boston, and what they've developed is extremely thin sensors. These sensors are paper thin, and within this shoe-shaped sensor pad, we can slip this in the shoe. It can tell us exactly how the foot's functioning. Now we know to the millisecond exactly how the foot's functioning. What we're able to do is to allow a patient to function symmetrically. Most problems that patients get, whether it's the foot, even the rest of the way the body functions during gait, is dependent on symmetry of motion of the body. This first gentleman has had 3 previous low back surgeries, still has a lot of pain. Our goal was to try and get him functioning symmetrically, try and get the hip engaged. I'll explain that in a few minutes what that means. I think I'll show you his belt position, how it's tilted off to the left from behind. You can also get a reflection from his hand position. You also notice when he walks, this knee appears as though he's limping. Now if we get this moving, let me start this again. Again, see how his left hand's peeking through. You can see how he shifted way off one side to the left. You can see how his knee, it appears as though he's limping on this side. The right side's not so bad. This is him, the end of the half day. Again, you can see his arms are moving. Hip position certainly improved. The belt's still dropping a bit. But if you look at his hand position, you can see the hand position is pretty close. One side, the other. So the left is still dropped somewhat relative to the right. But that's pretty close compared to what he had before. And if you'll notice, you'll see his knee on the right side is now starting to function. This is the same gentleman now, 4 weeks after he's had his orthotics. And again, he had no anti-inflammatories, no physical therapy. This is strictly with orthotics using the Tech Scan system. Again, you can see if you look at his belt position, his hand position, one side to the other. You see how fluidly his right knee is now moving. And he's pain-free. The second patient is a lady in her mid-60s. Has had chronic low back pain for 20 years. Had no success in getting it resolved. She came to me to see if the Tech Scan system would help her. I'll show you. This is her at the initial visit. If you notice her shoulders, they're dropping from side to side. Again, you can see that perhaps reflected best in her hand position. She's moving from side to side. Very short gait cycle. Weak, non-propulsive. Her arms not moving. This is the same lady at the end of the first day. You start to see she's getting a little bit of swing to her arm. She's beginning to use her knees again. And her gait's, the length of the gait has increased. This is the same lady now, 4 weeks after having her permanent orthotics. And she still has a little bit of motion from side to side. Her arms still don't have a full swing. You can see the tremendous change in her gait, length, and stride. And she's absolutely pain-free. This is going to show you on the computer exactly what we see inside the shoe. The sensors pick up all this information, load it up to the little box that the patient wears around the belt, and then we download that on the computer.